other professions. If I live 50, if you live 100 years, I live 190 years. So this is what of. So now how we do diagnose? The first and foremost, here also I will give you two important points. One is called the typical symptoms. They exactly related to the heart attacks. That is called the typical symptoms. Number two, I might segregate as atypical. Atypical. So where we people are missing from this atypical symptoms. मतलब अब heart attack मतलब everyone knows that the heart is situated in the center of chest, right? Physiotherapist, right? Where is your heart? Here. Left side where? Slightly left. So heart situated in center of our chest. Right side we have a lung, left side we have lung. In between two lungs we have the heart. We have the heart. This is the anatomy of our human anatomy where we see our heart. So अगर अपने को heart attack हुआ है, the first and foremost symptom we get typically center of the chest में sudden pain, sudden बोलता sudden pain. मेरे को दो तीन patient बताया ऐसा कि pain ऐसा रहता है कहता कि it is like a squeezing between two stones. This is words from my patients. One patient describes sir, ये दोनों पत्थर के बीच में अगर हाथ को रखिए आप स्क्वीज प्रेस करते हैं कैसा पेन होता है वैसा पेन होता है. That's one type of pain patient described. Another patient have told that sir, if you keep 110 to 210 kgs of elephant leg on our chest, ऐसा compress मतलब they different है. थोड़ी देर में ऐसा complete एक tight feeling, suddenly एक tight feeling होता है chest में. This is a typical presentation. या suddenly you have the profuse, it's very chest pain. जब इतना बर्दाश्त नहीं कर पाओगे, that is the typical chest pain. ये chest pain sometimes it comes into the left hand. It comes to the left hand, very very important. अगर ये left hand में यहाँ तक pain आ रहा है मतलब कभी भी no one should neglect. I'm telling you. Are some patients very rare among 10 patients, one patient or two patients gets into the right hand. अगर right hand में pain आ रहा है मतलब that is more significant. Right hand में pain, physiotherapist remember, it is not because of brachial neuralgia. How many of you know about brachial neuralgia? Do you know? Are you first year, second year? Second? Internist. We have finished the course. So you are supposed to know what is brachial neuralgia then. So right side hand radiating pain is more typical where we should not neglect in the heart attacks. Sometimes this chest pain will go from center to the back. This is also more typical. So why this pain changes from here to here, here to here? Because we have the heart like this. We have four friends. One is the front side. When it is affected on the front side, we get the pain here. When it is affected in the inferior portion, inferior bottom, we get the pain down and the back. When we get this left side and the back side, then the pain comes from here to here. So it depends upon the which area, which portion of heart got affected. Based upon that, we get the pain. That is the reason why it is not must that everyone should have the pain in the chest. Everyone should have the pain in the back. It's not everyone pain to the left hand. Everyone should have in the right hand. So these are the typical presentations, and sometimes these pains will associated with sudden profuse sweating. अगर आप शर्ट को ऐसा करो तो भी आपको पानी ऐसे गिरेगा, like a tap. इतना sweating आएगा, sudden profuse sweating, irrespective of pain, we should not neglect again. The two reasons, एक sugar कम हो तो भी वैसे ही symptoms होता है, second heart attacks, and that's the reason I'm stressing here. It's very important है, pain ही होना ही नहीं चाहिए, compulsory नहीं है, because diabetics में a complication called as neuropathy, in patients में pain नहीं होता है, they will not they will not experience this pain at all. So they will have only the sweating. So इसीलिए अगर कोई भी क्लासरूम में भी कोई सडन स्वेटिंग हो रहा है तो we should not neglect. पहले हम सोचना कि कुछ हार्ट का प्रॉब्लम है या नहीं. That is very important. And sometimes these pains are associated with severe nausea and vomiting. Patient को जो है ना उल्टी आए जैसे ये मतली उल्टियाँ होता है, ये मतली vomiting होता है. These are the typical pain associated symptoms. And sometimes atypical presentation, आप लोग को जो है ना atypical मतलब जो है ना अब pain होना जरूरी नहीं है. Some patients will get a typical gastritis symptom, gastric symptom, जैसा फुल एसिडिटी छाती में जलता है. So that is very important. Why? Because जो हार्ट को ब्रेन से नर्व सप्लाई करता है वेगस नर्व, वो नर्व जो है ना हार्ट को एज वेल एज स्टमक को भी सप्लाई करता है. Sometimes patient predominantly get only the gastric symptom. इसीलिए बोलूँ, so most of the patients जहाँ तक मैं भी देखा हूँ, I was experienced, people have died because of this acidity, because अपने इंडिया में individual को acceptancy tendency नहीं है. That is the first and foremost important why people are dying because of this heart attacks. Acceptancy नहीं, कोई डॉक्टर बोलते भी सुनता नहीं है कि at least ECG ले हो. In this regard, I will tell you a simple case of 25 years back when I was a very young consultant in 2000. He is also a doctor, that's in the Kerala experience. He is also a doctor. His wife is suffering from severe retrosternal burning, acidity symptoms and nausea and vomitings. As a doctor, he has treated for 1 day, that's good. Second day we treatment here, kam nahi ho raha. It was third day. Then he has told to one of our doctor, who is also a Rotary Club member like me. Then they came to me, sir, apna hi Rotary Club member hai. Since 3 days his wife is not doing good. He is treated him. That also is Sunday. Kerala में Saturday, Sunday is the typical weekend day. वहाँ पर अपना को चाय भी नहीं मिलेगा, दूध भी नहीं मिलेगा, साइकिल पंचर हो तो भी पंचर करने वाले भी नहीं मिलेगा. It's a very typical in India. I have seen the weekend concept. We are talking about 25 years back in Kerala. Saturday and Sunday आए तो अपने कुछ नहीं मिलता है. ठीक है, as a Rotary Club member है, वो भी डॉक्टर है, एक डॉक्टर का फ्रेंड है, अपने को रिक्वेस्ट किया तो then I have gone. ठीक है, पेशेंट एग्जामिन किया, सब किया, she is around डायबिटिक है, हाइपरटेंशन है, everything डिस्कस कैसे मैं बोला कि why we should not take one ECG? I want to take one ECG and let me see. So this doctor is a doctor. He was arguing with me. What nonsense you are telling me that to take ECG she is having gastritis? मैं क्या बोलूँ इसको अभी? Then I told my friend, what is the reason you have called for me? Then he told him, see, you want a specialist now, so he has come now, so you should listen to him. You should listen to what is advising. You did everything, irrespective of that she was not doing good. Now you came to a specialist and asking him his help, and again you are arguing with him. So let him do what he want to do. So I took an ECG. Whether you believe it or not, it is a massive heart attack. It is a massive heart attack. This is the very atypical presentation. That's the reason why when he was treating her since past 3 days, उसका nausea कम नहीं हो रहा, vomitings कम नहीं हो रहा, कुछ भी कम नहीं, because she is suffering from the heart attacks. Luckily, then I took her for a surgery, then I did a stenting, everything. She survived. But today her husband died. Still she is alive. Still she is alive. Her husband died. Nowadays she is 86 years. Now also she calls me on and off. She messages me on and off. So this is how the things are. So acceptance is actually कोई डॉक्टर कुछ बता रहे हैं. एक ECG 300 या 400 रुपए होता है, पुणे में little bit costly है compared to Nashik and other places. But even though if it is a heart attack, it saves our life. That is the reason why you should not a doctor को ECG कर लेने बोले, ECG नहीं किया तो भी आप अपने responsible हो कि ताकि आपको जाके ECG लेने से कुछ प्रॉब्लम नहीं होगा. And here in especially Maharashtra, most of the unqualified doctors are very high. BMS, BHMS, BMS, ECG किसी को कुछ नहीं आता. If you go to the ECG, go and get a report by an MD or a cardiologist. Another important thing, यहाँ पर ECG करते हैं, रिपोर्टिंग किसी को कुछ नहीं आता है. MD लोग रिपोर्टिंग करते हैं, half report they will do, half report they don't do. So ECG reading में भी बहुत variations होता है. I may feel sometimes with normal, उसको normal नहीं लगता है. But anyhow, and never depend upon the automated report of the ECG. आजकल ECG में automated report आता है. So that is very sensitive है. देखो कंप्यूटर है, small 1.05 millimeters को calculate करते हैं. उसमें उसको पता नहीं कि ये artifact है, ये real नहीं है. But never believe that computerized report. It has to be authenticated by a qualified cardiologist. But ECG is mandatory. आज एक माइंड में आपको फिक्स होना चाहिए. डॉक्टर राव ने हमको कॉलेज में ये बोला कि any प्रकार of atypical symptoms we हो, we should have an ECG irrespective of age and gender. This is very important. We should see. So another symptoms, some we are discussing in the boardroom. So body will definitely warn you. आपको बताते हैं कि heart attack होने वाले हैं. How? Some type of pain it will tell you first. Another important thing, sometimes we have the pain in the throat. A throat, a constricting feeling. We have a constricting feeling in the throat. That is very important. This jaw, sometimes we'll have a dragging pain in the jaw. Recently, above my clinic, one dentist का problem was. This is hardly 1 hour back story. The patient having a pain in the jaw since past 3 days. So dental का पास गए, ठीक है, this is how. I don't say that she is wrong. She around 45 years है, with diabetes है, डेंटल के पास गई है, मेरे क्लिनिक के ऊपर ही उसका क्लिनिक है. So dental doctor देख के ठीक है, we have to do a scaling for you and all those things. So she was doing the scaling. On her table only this patient collapsed. Because मैं नीचे हूँ, तो तुरंत वो डॉक्टर नीचे आके मेरे ऊपर लेकर गए. Then when I checked, she got a massive heart attack. So this is how it will happen. So the patients and the doctors will go. If I am a dentist, मैं dental की देखता हूँ, उसको सोच नहीं आता. If I say I am a cardiologist, मेरा focus पूरे इसके ऊपर ही जाएगा. वो दूसरा भी हो सकता है, pneumonia भी हो सकता है. Chest pain में even अगर suddenly lungs में भी blood block होता है. And how many of you know that? We call pulmonary embolism. Suddenly जो है lungs में जो heart से blood vessels जाते हैं, उसमें block होता है. That's very dangerous. तो वो हम मैं नहीं सोचता, मैं हार्ट अटैक के बारे में सोचता हूँ. ECG लिया, ECG नॉर्मल है, वो भी मैं सोचना चाहिए ना. So आपको that is a technical issue. But this is how it happens. So ये जॉब पेन भी जब अपने को होता है, डेंटल प्रॉब्लम हो सकता है, लेकिन एक कार्डियोलॉजिस्ट ओपिनियन लेने में बड़ी बात नहीं है. It's not a bad idea of taking a cardiac opinion. This is very very important. Another important I'll teach you today. If you see this earlobe, you will see a earlobe grease. मतलब ये लोब में ऐसा फोल्ड होता है. This is another important. ये दोनों के बीच में you will see a fold. You will see a scar fold like this. There is another important sign. एक ear देख के हम बोल सकते हैं कि whether this patient is, whether this individual is having a heart disease or not. अगर heart disease को heart attack हो रहा है, it will get fold like this, and you will see a very good crease and groove over here. This is another important atypical sign where हम देखना पड़ता है. This is what we should see. This is what we should see. Another important इसमें और एक होता है कि some patients will suddenly complain of a pain in the nape of the neck. ये पेन्स जो है ना, ये जॉ पेन है, थ्रोट पेन है, ये नेक पेन है, इसको हम कभी भी नेग्लेक्ट नहीं करना चाहिए. दिस इज वेरी वेरी इंपॉर्टेंट. दिस इज वेरी वेरी इंपॉर्टेंट. Another important we call exertional dyspnea. When we just ये 2 स्टेप या 3 स्टेप या फर्स्ट फ्लोर या सेकंड फ्लोर जाते, we will have breathlessness. That is the very early symptoms in especially elderly age group में. और हमको 1 फ्लोर 2 फ्लोर चढ़ से दम लग रहा है, मतलब something is wrong. That's what our body will warn us. Body will tell us. That's very important. And also you will feel breathlessness. If you take a rest of 2 minutes or 3 minutes, immediately it will subside. That's the classical symptom where we should not neglect. हम notice करना चाहिए something is wrong is there. That is called exertional dyspnea or exertional chest pain will get. It will be relieved by taking the rest. अगर आप रेस्ट लेते हैं, it will come down. This is another very important feature where it tells about us. This individual is having heart attack or not. This is the few important symptoms I am telling you. I cannot tell everything. It's not possible also to cover it in 1 hour gap. So these are the very important points where I am stressing. Now what we should do now? What is the ultimate treatment? How we can save this time? Whenever you get any chest pain, the first and foremost important thing, you should see a cardiologist, and it has to be evaluated as very 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 important thing here. But now how we can prevent? Is it treatable? Yes, it is treatable. Is it preventable? Yes, it is preventable. Heart attacks are preventable. Remember that. Heart attacks are preventable. Death is not preventable, but heart attacks are preventable. My main motto coming before you and talking regarding because you should have an idea that heart attacks are preventable. हम prevent कर सकते हैं. Sudden premature death हम prevent कर सकते हैं. Immature death हम prevent कर सकते हैं. Because you people, including me, we should not die suddenly, prematurely. We should not die. This can be prevented. But how? It's very simple that if you have any diabetes, proper medication, proper treatment, and your sugar should be under good control. If you have the blood pressure, proper treatment, proper medication, and your blood pressure should be under normal. Physiotherapy, what is the normal blood pressure? 125? That's good. So we should maintain the blood pressure. And another important thing I'll tell you, जब डॉक्टर लिखता है कुछ ट्रीटमेंट फॉर डायबिटीज या कुछ ट्रीटमेंट फॉर ब्लड प्रेशर, पेशेंट बोलता है सर आदत पड़ता है, सर बोलिए तो हम दुनिया इम्पोर्टेंट थिंग व्हाट दे आस्क मी रिगार्डिंग द साइड इफेक्ट्स. सर साइड इफेक्ट्स कुछ है क्या? हम रोज थम्स अप पीते हैं, रेड बुल पीते हैं और कोका कोला पीते हैं, फैंटा पीते हैं, उसमें साइड इफेक्ट्स नहीं है. नो एनी साइड इफेक्ट्स. जब डॉक्टर के पास जाते हैं, ट्रीटमेंट जब लेते हैं, दवा लेते हैं, सर साइड इफेक्ट्स है क्या? This is the first question what they will ask to the doctor. See, never be in this false imagination side effect saying, oh, doctor knows more than you. This is what you think that. अगर डायबिटीज है तो हम क्या करते हैं? नहीं सर मैं रोज मेथी खाता हूँ सर, बिल्कुल रोज एक घंटे एक्सरसाइज करता हूँ. यस यू राइट. मेथी खाते हैं कंट्रोल होते हैं, लेकिन कंट्रोल नहीं हुआ तो क्या करना? We have to take treatment and we have to get it normal. अगर डायबिटीज आप नॉर्मल नहीं लाते हैं, as we have discussed, कोलेस्ट्रॉल बढ़ता है, एलडीएल कोलेस्ट्रॉल बढ़ता है, ब्लॉक्स बनता है, one fine morning हमको हार्ट अटैक होता है. So blood pressure का गोली भी वैसे ही है. And especially in the youngster age, especially college students, where I have seen many people are suffering from the blood pressure. So the treatment we should not neglect when we are suffering from this diabetes or when we are suffering from the blood pressure. If a doctor advises you the medication, we have to take the medication. It's very important. And controlling of the cholesterol, in that I have told you the importance of the thali, how you should design your thali. How you should design the thali is another important factor where we can control the cholesterol. Another important thing that our diet should contain high rich amount of fiber diet. Fiber, the simple sources में आज बताऊंगा. Brown rice is very high rich in fiber. Brown rice is very rich in fiber, right? And oats is also very high rich in fiber. And chia seeds also having very rich in fiber, right? These are the three important things. अगर आप ये इसको फॉलो करते हैं तो रिच फाइबर डाइट से अपने को शुगर भी कंट्रोल होते हैं, कोलेस्ट्रॉल भी हमको कंट्रोल होते हैं. So this is what we have to practice. Another important thing, dry fruits. Dry fruits are around 8 to 10 grams of dry fruits per day. ड्राई फ्रूट में आपको मर्जी को आपको कौन सा पसंद है खा सकते हो. काजू खा सकते हो या बादाम खा सकते हो या एनीथिंग व्हाटएवर यू लाइक इन द ड्राई फ्रूट्स. किशमिश खा सकते हो. एनीथिंग यू लाइक यू कैन ईट द ड्राई फ्रूट्स 10 grams. Especially that watermelon seeds and this muskmelon seeds are very good in that we have lots of antioxidants. Another important thing over here is that sugar diet, as we discussed. Sugar, carbohydrate, simple carbohydrate, especially in the rice preparation. White rice, बोलते हैं तो दूध मलाई rice, that is high rich of sugars that we should avoid. In fact, so rice preparations should be avoided, and potato family vegetables should be avoided, which are rich of sugars, which are very rich in sugars, and the sweets, especially the insects, we should avoid. So high sugars are the main important risk for getting the cholesterol. Cholesterol बढ़ने के लिए oily non-vegetarian is not the source. Correct family means come on. The main villain for cholesterol is the carbohydrates. Carbohydrates, sugars are the main reason for getting high cholesterol. Never the oils. Agar if you ask me which oil is good, olive oil have been documented recent 2 years back. Olive oil is very good oil among all other oils. And olive oil is the cost-effective barrier because 1 kg costing roughly about 1,200 rupees. So it is very cost-effective, especially in our country. So olive oil, especially of the 30 years and the 40 years, if you have diabetes or the blood pressure, some cholesterol disease, 1 spoon of raw olive oil you can practice daily, especially the youngsters you want to go for the gym or you want to go for the morning physical activities. Olive oil really helps you a lot. To be active or brain, which vitamins or which type of food you require? Any physiotherapy is type of brain active रहने के लिए what we need? We need the fats. We need the fats, not the glucose. अगर brain active रहना है, brain survive होना है, brain needs among carbohydrates, among proteins, among fats. It requires fats. And lack of children and the impotency for the testes and for the females to function properly in the sexual organs, again fats are important. अगर fats कमी है, infertility main reason is lack of fats. So fats को उतना neglect भी नहीं करना चाहिए. It should be the optimized levels. Fats are very important in our day-to-day life. So इसीलिए especially for the youngsters, I tell you for the youngsters, Olive oil, one spoon in the morning if you take, that helps you a lot in many ways. And also, it also helps in controlling the diabetes also, in controlling the blood pressure. So this is how it helps you. And you should have a habit of taking some fruits and some raw vegetables. Fruits, matlab, again I'll give you one example. This is almost a year story of a patient from Nasik. He is a very young, 35 years, young man who has come to me with a report of cholesterol, in which these triglycerides are really very high, around 700 to 750. Then I said that you are very young, but triglycerides are high. I don't want to treat you. You go for a lifestyle modifications where you go change your diet plan. So increase your fruits. I asked you to increase your fruits intake and vegetables. Really, he was really taking the fruits. So on one fine morning after 3 months, he has come. I have reached him. His triglycerides have gone to 4,200 something. I got shocked myself. What you did? So finally, when I was talking to him, he was telling he was eating minimum of 1.5 kg to 2 kgs of grapes daily. They said, what is this? Sir, आप ही तो पता है फ्रूट्स खाने के लिए मुझे। मैं फ्रूट्स खाने के लिए बताया, लेकिन अब 2-2 kg 3-3 kg खाने के लिए थोड़ी भी बताया। So the importance of sugars is that much, or the cholesterol. तो जितना शुगर डाइट हम लेते हैं, उतना कोलेस्ट्रॉल बढ़ने का चांसेस वेरी हाई रहते हैं। That is the reason why controlling of the cholesterol, try to reduce the carbohydrated food, which helps in reducing the cholesterol. It's very important. Another point here is smoking and the alcohol is very important. Alcohol is not a problem. Like smoking or tobacco in any form, it has to be stopped. Especially the youngsters, if you are in habit of smoking and all those things, it is advisable. It is advised you all to stop of the smoking, especially the passive smoking हम बस स्टैंड में रहते हैं. आप लोग this is the time for और कोई पीते हैं सामने सिगरेट, you should tell them ये पब्लिक प्लेस से सिगरेट क्यों पीते हैं? Because that fellow is FMU 10 people. मैं यही बोल रहा हूँ, आप लोग नहीं पीते हैं तो भी पैसिव कोई मैं वहाँ पर आपके सामने नहीं पी रहा हूँ, so that passive smoking is more dangerous rather than the active smoking. So that is tobacco in any form is important. आप डरने का बात ही नहीं है, बिंदास उसको बोल सकते हैं, especially you the girls. At least एक गर्ल बोले तो, 2 गर्ल बोले तो, 3 गर्ल बोले तो दूसरों को भी डर लगता है. You should take an initiation for everything. If you don't take any initiation, it is not possible to stop all these things. So we have some environmental responsibility. इसके लिए मैं ये नहीं बोलता कि आप लोग रोज संडे जाके झाड़ पौधा डालो, वो करो, पानी नहीं बोलते. Certain things which are in front of us that can be prevented, that can be stopped. So this is important here. Another important thing is that ensure intake of fruits, but not of taking 1.5 kg, 2.5 kg, 3 kg of fruits not per day, but a cup of fruits you can take. That's very important. And ensure the intake of potassium. You can have the leafy vegetables. You can have more leafy vegetables. You can have the fruit salads. You can have the vegetable salads more. But in beginning, I have explained very much clearly about how to design what thali. This thali designing is in your hands. So daily you can change your menu. So this is how we can prevent these heart attacks. Once if we do not have the heart attacks, then definitely we are going to live very much happily. This is in brief. I have taken you in 1 hour time. If possible in future, we will have some big workshop where we can, when we can have the good crowd, we will try to learn more and more. Now it's a time for us to interact. If you have any questions, please come forward. I'll definitely try to give a very reasonable answer for you. Thank you.